Workplace mental health has increasingly become a concern for leaders of organisations throughout Asia. But the COVID-19 pandemic really threw into sharp relief just how important it is for organisations to support their employees' mental health. So when it comes to what leaders can really do to move the needle on workplace mental health, the most important takeaway is that it's really vital to mainstream interventions and efforts throughout the organisation. Improving workplace mental health cannot solely be the domain of HR. Now, when it comes to the specific interventions that can be implemented, one domain is that of organisational resilience. So what we mean by organisational resilience is improving the systems, structures and processes to ensure employee wellbeing is maximised. Some examples of good interventions in this domain seen during the COVID-19 pandemic included leadership discussions around mental health, really open discussions in multiple communication forums around the importance of mental health and normalising the discussion around it. Similarly, there's really tactical structural things that can be changed. For example, one company implemented protected lunch breaks to ensure that employees felt able to take a break from endless video conferencing. These sort of structural interventions are really important to ensure individual wellbeing. Another domain in which companies can implement interventions is around individual resilience. One popular intervention amongst companies was to make meditation or mindfulness apps available to their employees during the pandemic, so they were equipped with the skills that they needed to maximise their mental wellbeing. Similarly, some organisations ran group virtual exercise classes, given the significant link between physical activity and mental wellbeing. Now, how do companies ensure that these changes are sustained in the long term, not just throughout the pandemic? Now, there's a few things that can be done here. Firstly, it's absolutely vital that a whole of organisation approach is taken because it's just far more likely that the changes will be sustainable. Another thing that can be done is to be data-driven. Make sure that all of the interventions that you're implementing as an organisation are tracked for uptake and also for effectiveness and employee responses to understand if they are genuinely moving the needle on mental health. And finally, a really important thing that organisations can do is co-design interventions with their employees. The more you co-design with employees, the more likely you are to see significant buy-in and therefore uptake, but also making sure that you actually get to the root cause of some of the problems around mental ill health in the workplace and therefore design interventions that truly tackle these root causes.